All right, now take a look at beef heart. Yes, so rats' hearts, being that rats are small animals, are small, but cattle are big. So we're going to take a look at a big old cow heart. All right, so as you can see, it's got a lot of fatty tissue on it. This one has been sectioned so that you can look inside and see the various structures. So, quick quiz, which do you think is going to be more muscly, the left side or the right side? Now, it's your left and right. So the cow's left or the cow's right. Answer is the right side is going to be smaller. So this is going to be the right side versus this is going to be the left side. And the reason is because the right side only needs to pump blood to the lungs, whereas the left side needs to pump blood to the entire body. So you can see the wall, the cardiac wall made up of cardiac muscle, much thicker on this, which would be the left side. Okay? So we need to know what is the pathway of blood through the cow's heart. So here, where I have my finger now, this is the vena cava. You can see it's branched in two because there's a superior and an inferior vena cava that both feed into the there we go. There's a superior and the inferior vena cava. Both are going to feed down into the right atrium, which is this bit up here. It's going to go through the tricuspid valve. You can't see the three parts of the tricuspid valve, but trust me, they are or were there for this cow. These stringy bits down here are called the chordae tendineae, and they help keep the valves, the flaps of the valve. What are they called? They're called the semilunar valves. Anyway, they prevent those from prolapsing or kind of going back against the flow of where the blood's going to go. All right, so blood flows in through the right atrium into the right ventricle, then it's going to get pumped out of the right ventricle through this thing here is the pulmonary artery. Okay, so the pulmonary artery is going to carry blood to the lungs. So the blood at this point is deoxygenated. It's come from the vena cava, which is the main vein in the circulatory system. It's going to carry blood into the lungs, where it's going to be oxygenated, and then that blood is going to be returned to the left atrium, over to the left side, by the pulmonary vein. So vessels that leave the heart are the arteries, vessels that enter the heart are the veins. So the pulmonary vein, which is going to feed into the left atrium, this is the only vein in the body that provides oxygenated blood to the heart rather than deoxygenated blood. We typically think of arteries as having oxygenated blood and veins as having deoxygenated blood, but with the pulmonary artery and vein, the opposite is true, because the pulmonary artery is taking the deoxygenated blood to the lungs to be oxygenated. The pulmonary vein, which is where this connection here, where my fingers are, is going to feed back into the left atrium. So the left atrium is going to feed to a bicuspid valve, remember lab rat, which is going to come down into the left ventricle, and that is going to pump the blood up to the aorta. So this here, I'll stick a tube through. This coming in here is now the aorta. In the aorta, shortly after it leaves the heart, it branches into 3 branches to take the blood that has been oxygenated out to the rest of the body. So let's see, we get all the things: left atrium, left ventricle, bicuspid valve, tricuspid valve, left ventricle, right ventricle. Yep, we've got the atria, we've got the ventricles, and that's it. So when a patient has, a human patient has cardiac arrest, typically what's happening is that there are a number of blood vessels that feed the muscle itself. And those are very fine. Like the coronary artery, for example, is one of the arteries that feeds blood directly to the heart. Now, if any of those have occlusions or blockages, then that's bad, because then the heart muscle isn't getting the blood that it needs, and that's what leads to things like heart attacks. It's not that these giant vessels like the aorta and the vena cava are going to become occluded by plaques because they're just too stinking big. Usually something else is going to get occluded first. Okay, but another thing that can happen is something like an aortic dissection, where there can become a tear in the aorta, and that is another type of cardiac problem and that leads to spontaneous death. That can kill somebody very quickly, versus something like a coronary artery occlusion. Typically that's something that can be diagnosed and treated with medications or stents or things like that. All right, so there is your beef heart. One more time, why not? Okay, so remember, we've got the right side. It's going to be fed by the vena cava, superior and inferior. Where's that other part of the vena cava? Superior and inferior vena cava are going to feed into the right atrium, right ventricle, pulmonary artery, out of the heart into the lungs. Pulmonary vein is going to feed back around into the left atrium, left ventricle, and then out through the aorta. That is your pathway of blood, so you should know that, as well as which of those vessels have oxygenated and deoxygenated blood.